Hello, hello, hello. Hey, everybody. We're going to get started in just a moment. Good evening. Good evening. Good evening. I'm getting ready to get started. I just wanted to take a moment to share this video in my Facebook group, and I'm trying to pull this up on my phone. I'm having some issues on my phone. Let's see. Let me exit out of YouTube and go back in. I have to be on my phone watching because that's the only way I can see your comments as I'm going through the presentation. So, hey, everybody. Hey, Deidre. Hey, Tara. Hey, Yanni. So, got some of you guys watching on Facebook, some of you guys watching on YouTube. You guys can hear me, right? Can you just confirm you can hear me? I got my microphone plugged in. Just confirm that you can hear me, please, if you don't mind. All right, so we're going to get ready to get started. All right, let me hide this banner. So before I even get started, so I noticed this week that I've been having quite a few people who were joining for the first time. So if this is your first time visiting my channel or joining live, just to tell you guys a little bit about me. First of all, I'm a mommy. That's my daughter in the picture with me. She's 18, about to be 19. I've been an MA since 2004 and an MA instructor since 2011. So I teach every day. I'm in the classroom teaching every day or virtually. And what I do here on YouTube is I just take what I teach in the classroom and I teach it here on YouTube. Outside of medical assistant, being an instructor, I'm also an author. I've written 4 books and I'm also an entrepreneur. And then these are some of the things I sell a lot of things, but these are some of them. These are all medical assistant things here. If you ever want to get any of my t-shirts, which one I'm wearing now, let me see. I don't even have my camera. I'm not even on the camera yet. Which one you guys see me wearing now, this medical assistant t-shirts. If you ever want to get any of my medical assistant gear, you can always go to my site, shopwithmizzk.com. And that's going to be the MA collections. Okay. I got t-shirts, mugs, pillow, all kinds of t-shirts, customizable necklace. Just make sure you write in the notes section what name you want on the necklace. So that way, you can get a personalized. One thing I do want to mention. So yesterday we went over suffixes. Before we get into root words tonight, I want to let you guys know I left off a few of the suffixes. So we actually going to start with suffixes, just a few suffixes. Sorry, y'all, tonight that I didn't get to last night that are important because you may see it on your certification, okay? And for anybody that was not here the last few days, you may have missed that I am planning to go live every single day this month. Why? Because the 4th week of October is Medical Assistant Appreciation Week, but I'm making the whole October Medical Assistant Appreciation. So I'm going live every day, going over different topics, okay? Also, let me just drop the call-in link really quickly. If anybody, I know somebody last night said that they were going to call in. If at any point anybody wants to call in at the end, the link is there. And I'm going to pin it in the chat real quick. All right. And let's go ahead and get started. And if you do decide to call in, it'll be at the end. You don't have to come on camera. You can just do your audio only. Ask me a question, share something, or whatever. So let's get it started. Again, we're going to do the suffixes first that I missed last night, and then we're going to get into the root words, okay? So let's get it started. And if this is your first time joining live, the way it works is that I put something up on the screen. I give you guys a few moments to put it in the chat, and then we keep it moving. And like y'all, this is a long one tonight. I don't know how long y'all have tonight. I don't know how much time y'all gonna spend with me tonight, but root words, we went over prefixes and suffixes already, but there are so many root words. And, even as long as my presentation is tonight, it's still not even covering everything. So just be prepared that tonight is going to be longer than the other 2 nights. So I didn't see anybody write this in the comments, but at least not on YouTube. Let me check Facebook. So pexy is fixation or to put into place. Let me move this over here because I don't want to have to keep. Let me put that right there. All right. Emesis, or emesis? Oh yeah, okay, Cherry. I'm sorry, I missed your comment. Yep, pexy was to put into place or fixation. And if you guys happen to have any questions I will address them at the end. Oh, Brianna, I see you said you used my course, which helped. Oh, congratulations, Brianna. Brianna passed her test this morning. Congratulations. So she's referring to my MA refresher course. If you happen to, if you're about to take certification, my MA refresher course is a study guide, and I'll tell you guys about that in a little bit because it is included in this presentation. Yep, if you put vomiting, you are correct. Penia. You know what? I don't remember if I wrote in what penia is. I don't remember writing the definition of penia. So I may have to, you guys may see me have to edit it and add it because I don't remember putting the definition for penia on my slides. So if it's not on the next slide, then I know what I need to do. All right. Oh, I did. Oh, deficiency or decrease. Okay, I didn't think I added it. Okay. Yep, deficiency or decreased. All right. So, trophy. And while you guys are writing the answer to trophy, let me just address it. So somebody said less breathing. So, for penia. So no, it doesn't. So you guys are thinking of apnea, and a lot of people get those confused. So it's common to get those confused. So apnea is PNEA, that refers to breathing. Penia, PENIA, that refers to decreased or lack of or deficient. Cherry, can you see my slides or something in advance? Because you on it. Because some of these are difficult. Somebody has clicked on the chat. Let me see who that is. That's Sandra. Sandra clicked on a call in. Should I take this now or should I wait to the end? Sandra, I wanted you guys to call in on the end, but if you have a question now, I can take it really quickly. Do you guys mind if I take a quick moment? Oh no. Okay, so she left. Wait a minute. Let's see. Okay, so she clicked off. So Sandra, if you do have a question on anything, just go ahead and at the end, just click on the call in link. Rex says, okay, Cherry said, I study every day. I know that's right. That's good. That shows that that the way you're answering these, because these are some of the more difficult ones and you know it. So this is really good. Rexes. If you put rupture, you are correct. If you put rupture, you're correct. Let me click right here and check on my Facebook people real quick. Oh no, Sandra, it's okay. Don't be sorry. Don't be sorry, Sandra. Are you able to hang in there to the end? Or if not, I can get you in there really quickly. Just comment and let me know. And I can squeeze you in there. It's okay. All right, hepato. Now we're in the root words. Oh, so guys, now we're in the root words. So those were some of the suffixes that I missed yesterday. So that's why you see some suffixes. That's why you saw the suffixes, but the title says root words. That's because those were some of the suffixes that I left off yesterday. So if you missed yesterday and Tuesday, make sure you check that out. Tuesday we went over prefixes, and then yesterday we went over suffixes, but I missed those. So now we're getting into the root words. Hepato, yep, is liver. Nephro or reno. And y'all, this, as I always say, this terminology is key. It is so important. This is what's going to help you. I mean, you need to know terminology just as a medical assistant, period. But when it comes to certification, it's really going to help you answer many of the questions that you come across, just simply knowing terminology. Kidney, yep. Cardio or cardi/O. So you guys notice I already have the O attached. So keep in mind. So one of my students asked me, how come sometimes I see cardi, sometimes I see cardio, or hepato, or sometimes I just see hepat. So keep in mind that when the O is attached, that is considered a combining form. So if anybody is watching this or you're live with me right now and you're learning about terminology, the O is a combining vowel, right? Once you add that combining vowel to the root word, it becomes a combining form, okay? So that's why sometimes your book, if you're wondering why sometimes you may just see the term itself, but no O, sometimes you'll see the O attached. So I just wanted to point that out for anybody that's just now learning terminology, because like I said, one of my students asked, and I can understand why that can be why that can be confusing at first. Yep, if you say heart, you are correct. Pod. What is pod or podo? Pod. Hey, Jackie. Yep, pod is foot. Phlebo. Phlebo. Yep, vein. If you put vein, you are correct. Cysto. Hey, Quizm. Hey, L. I see some of you guys have been joining me all week. I see some familiar names on here. Bladder. Bladder. All right. Cholacysto. So listen, y'all, let me tell you something funny while y'all writing this down, while y'all writing the answer to cholacysto. I was just telling my students earlier today in class, all these years I've been saying cholecysto, but it's actually cholacysto. Cho is actually cho, not co. And I think I was saying co because I'm thinking, okay, I'm thinking about the colon and, and I think that's why I said co instead of cho, but it's actually cholacysto. So it is gallbladder, gallbladder. So cho does refer to the bowel, Lynn, and then cysto is bladder. Cervical. Cervical. So cervical is referring to the neck or the cervix. Thoraco. And one thing I will tell you guys, I mean, I hope if anybody is on here and you're studying terminology right now, I hope you're making flashcards and making notes of this as we're going through them. But one thing I will tell you guys, make sure when it comes to your root words, make sure you can identify every part of the body. Okay. Every single part of the body, you should be able to know the medical term for that part of the body. Okay. Chest. Yep. Cephalo. Oh, you're thinking of ZZ said it sound like throat. Oh, you're thinking of the pharynx. Cephalo is head. So if you put head, you're correct. Encephalo. What is encephalo? Now, head is cephalo was head. Encephalo is what? What does en refer to? En refers to within or in, right? What is within the head? The brain is within the head. Yes. So, and I did see a few people got those mixed up, but yeah, cephalon is head and cephalon is brain. Hemato or hemo. Hemato or hemo. Yep. If you put blood, you are correct. Erythro. Erythro is red. So somebody put red blood cell. So once we join erythro to site, which we saw yesterday on the suffixes presentation, site means cell. So erythrocyte means red blood cell, but then erythro by itself just refers to red. Euro. And while you guys are answering that, let me turn my air conditioner off because it's cold in here now. Yep, urine. Cyano. Yep, y'all are quick. Yep. Blue. Yep. So like cyanosis, that's a condition, like what a patient is blue in color. We learned osis yesterday was condition or abnormal condition. What is leuco? Yep, leuco is white. Yep, leuco is white. So going back to site, leukocyte is what? White blood cell. Melano or melano. Melano. Black. Yep. So just make sure you guys know all those colors. There's more I didn't include here, but make sure you know your colors. Mayo. Mayo. So Mayo is muscle. Mayo is muscle. Now I noticed somebody put heart. Now if we say let's I'm gonna give a whole term. I'm gonna say myocarditis, right? So if we look at the term myocarditis, I'm only mentioning this because I noticed somebody put heart. So if you see myo and of course myocardial together, right? That means the heart muscle. And let's just say we see myocarditis. Yesterday we learned that itis is inflammation, so that would be inflammation of the heart muscle. But no, myo itself doesn't mean heart. Myo itself means muscle. But if you see them together, myocardial, that's referring to the heart muscle. Myelo, not to be confused with myo. This is myelo. Bone marrow or spinal cord. I see you guys got that. Yep. All right. Neuro. Yep. If you put nerve, I see everybody put nerve and nerves in. Yep, you're correct. Thrombo. Yep. Thrombo is clot. Yep. Arterial. Well, arterial, I should say, not arterial, but arterial. Yep. Artery. Yep. Electro. What is electro? Yep. If you put, I see somebody put electric. So, yep, electricity. So let's add that electro to cardi and gram. We learned gram yesterday was a recording, right? So if we say electrocardiogram, that's a recording of the electrical activity of the heart, aka EKG. Okay, guys, just a quick intermission here just to show you guys my MA refresher course. If you are studying for certification and you need a online study guide, this study guide is for any certification because it's all foundational information. Just like I'm teaching you guys here on this live, I do the same thing on here. I go over lessons. I have some quizzes on it, which I'm showing on the screen right now. It'll show you what answer you got correct. If you got it incorrect, it'll have a red thing beside it. So there's quiz questions, practice tests on there. It's about 400 and something practice questions altogether. So that's marefreshercourse.com. And also, of course, you have my videos as a free resource as well. But this is just for anybody who would like to actually purchase the study guide. Oh, Yanni said, I love that course. I took it. I'm glad, Yanni. I'm glad it was helpful. Glad. So glad. That was the goal. All right. Back to it. Ophthalmo. Ophthalmo. Yep. Ophthalmo refers to the eyes, the eyeballs. Okay. Adeno. Adeno. Yep. Gland. If you put gland, you are correct. Rhino. Yep, nose. So let me ask you guys this. What will rhinoplasty be? Rhinoplasty. So we learned plasty yesterday. Rhino is nose. If somebody could just put that in the comments, what will rhinoplasty be? Osteo is the next term. Osteo. And somebody tell me what will rhinoplasty be? Nose surgery. Yep. Or surgical repair of the nose. Yep. Osteo is, let's see. I see you guys putting it in there. Bone. Yep. Osteo is bone. Yep. Surgical repair of the nose for rhinoplasty. I see you guys putting that in there too. Arthro. What is arthro? Arthro is joint. So let me ask you guys this. So osteo is bone, arthro is joint. We learned yesterday what itis was. What would osteoarthritis be considered? Osteoarthritis. What would that be considered? And you can just write it in the chat. I'm going to go ahead to the next one. Osteoarthritis, based on what we know. Auto or oto. Oto. So inflammation of the joint and what else? So yep, it is inflammation of the joint because arthro, but what else? Inflammation of the joint and something else. Osteoarthritis. Yeah, inflammation of the joint and the bones because osteo is bone, arthro is joint, so it's inflammation of the joints and the bones. Yep, oto is ear. Carcino or onco? What does this refer to? Carcino or onco? Yep, y'all are on it. Cancer or cancerous? Yep, y'all are on it. Dermato. Dermato. What is dermato? Dermato. Dermato. Is the skin. The skin is the largest portion of as I said, the largest portion. The skin is the largest organ of our body. Which system is the skin a part of? Which body system does the skin belong to? The skin is the largest organ of the body, and which body system does it belong to? Lateral or lateral. Yep, integumentary system. Yep, that's the integumentary system. The skin, nails, and hair. All right, lateral. What is that referring to? Okay. Yep, the sides. So I noticed somebody put one side. So yesterday we went over, Tuesday we went over prefix and uni was one. So if you see unilateral, that's referring to one side. And then bi was two or both. So bilateral will be both sides, but lateral itself is just simply side. All right, pneumo or pulmono. Pneumo or pulmono. Yep, pneumo and pulmono both mean the lungs. Next, what do we got next? Let's see. Procto. Procto. What is procto? Procto. Procto. Rectum. Procto is rectum. Procto is rectum. Plural. 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 So if you put rib or side, you are correct. Gyneco. 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 Female. Yep. Glyco. Not to be confused with gyneco. Glyco. Yes. So the yes, whoa. So the gynecologist does specialize in, the female organs, but it specifically means female. It does. They do, of course, do vaginal exams and specialize in the vagina, but also all things dealing with the female reproductive system. Glyco is glucose or sugar. Cho. Oh, I mentioned this earlier. Cho. And y'all said it earlier. I forgot who it was that said it earlier. So I see somebody just came in backstage. So we're almost, once we get to the end, I can, if anybody wants to join the call link and just wait backstage, you can. Somebody is waiting back there. You can feel free to click on the link and I'll just get you guys in the order that you come in. But I'm going to get through these last few and then I can take your question or comment. Cho. So not cholesterol, bile. Oh, you know what? I just thought about it. I don't even think I put the I don't even think on here. I don't even know if I put the medical term for cholesterol, guys. Now that you mention it, I don't even think I put it on here. Somebody tell me the medical term for cholesterol. Somebody tell me the medical term for cholesterol, the root word for cholesterol. I did not put it on here, but CHO refers to bile. Gastro. What is gastro? Yeah, so lipid, lipid is cholesterol. What is gastro? The stomach. Yep. What is entero? All right, small intestines. Yep. So yesterday we learned that ologist was a specialist. So if we say um, a a cardioenterologist, what is that? What is a cardioenterologist? If we combine cardio and entero together with ologist, what would that be? And anybody can put that in the chat. I'm gonna go ahead to the next one. What is fibro? Fibro. Yep, specialist for the heart and small intestines. Yep. A cardioenterologist is a specialist for the heart and the small intestines. Yep. Yep. Heart and small intestine specialist that studies the heart and the small intestines. Exactly. Yep. Okay. Fibro is muscle and tissue fibers. So yeah, you guys are right. Fiber. Yep. Zizi, I see you put a question mark. Yep. You were right. Fiber. Yep. Muscle and tissue fiber specifically. Ufro or uforo. Ufro. ovary, hystero, hystero, yep, if you put uterus, you are correct. Now, while we're still on the female reproductive system, salpingo. Why don't we just stay on the female reproductive system for a moment? Salpingo. What is salpingo? So we had the ovary, we had the we just did the dang, what did we just do? I forgot just that quick. Oh, the uterus. What is salpingo? Fallopian tubes. Yep. Trick. What is trick? If you put hair, yep, you're correct. Trick is hair. Trick refers to hair. Litho. Not Lizzo. Litho. Litho. Litho is stone, like a kidney stone. Histo. What is histo? Not hystero. Not hystero, which means uterus, but what is histo? Yep, I see the answers coming in. You are correct. Tissue. Okay, cyto. What is cyto? Yep, cell. Chondro. Chondro. What is chondro? Chondro. What does chondro mean? Chondro. Let me look on Facebook, see if anybody put anything on Facebook. Okay. Yep, y'all are on it. Cartilage. Y'all are on it. Now, I did mention that I was going to give you guys the plurals. So you guys can feel free to maybe, let me move my phone off from in front of me for 1 second. I'm going to stop my camera for 1 second and just do a full screen. Feel free to screenshot this part right here. Okay, feel free to screenshot this part right here. So you make sure you're familiar with your plural ending. So your terms ending in A, your plural ending will become AE. There's an example there. AX will become ACES. EN becomes INA. IS becomes ES. IX becomes ICES. EX also becomes ICES. ON becomes A. UM also becomes A. US is I. Y turns to IES. And then MA turns to MATA. So if you have not already, make sure you take a screenshot of that. Okay. So this is important to know as well. You got your singular ending and then you have your plural ending. Okay. And that is the conclusion for tonight. Let me know if you guys have any questions. I'm going to stay on here for a little bit. Let me know if you have any questions at all. If you want to call in at all, feel free to do that. I will leave the link again. A couple of people came on earlier and left out. Somebody asked me, do I do private sessions? So I do one-on-one calls at bookwithmissk.com. I do a 15-minute phone call you can do that 15-minute phone call. Or you can, I noticed that you had logged in earlier, Karen. If you want to log back in, you can. You're welcome, MN. Anybody have any questions? Let me go to the main chat so I can see the comments on Facebook and YouTube. So guys, tomorrow I'm going to go live. I don't know exactly what show I'm going live tomorrow, guys. I'm going to be honest with y'all because I have so much to do tomorrow, but I'm keeping up with the challenge to go live every single day. So I will be going live tomorrow. I just don't know what time yet. Okay. All right. So I got Yanni here. Okay, Yanni, hold on one second. Let me get the best way. Oh, actually, I can just add you to the stage and unmute you. Hey, Yanni.
Hello, I want to say thank you because I have the my refresher in May and I
Uh-huh.
did all of the model and that helped me to feel more prepared for my test that I'm going to take on Wednesday. And
Yes.
also the YouTube live is helping me a lot and what I'm doing is if I know somebody that is going to start going to school, I'm just advising start a strategy in the beginning, not at the end.
Yes. Yes, Yanni, that makes me so happy. I'm glad to know the course is helping you. So you say your test is Wednesday. Which test are you taking?
It's the NHA CCMA.
Okay. Oh, perfect. Yes, I can't wait. I cannot wait to hear that you pass. I know you're going to pass, Yanni. I know you're going to pass. You got this.
Thank you in the name of Jesus. Thank you.
Yes, amen. In the name of Jesus. I know that's right. Amen. They're saying good luck to you in the comments, Yanni.
Thank you so much to
You're
everyone. God bless you.
you're welcome. Let me ask you this one thing before you go, Yanni. A piece of feedback for me. Is there anything that you think that I should add to it or maybe possibly do different on the course?
Um, Not really because all the information. First I used to watch the videos and then I took the quizzes and
Okay.
then out. I feel that it was very complete.
Okay, gotcha. Okay, good to know. Thank you, Yanni. And let me know when you pass on Wednesday.
I will.
Okay, have a good night. Thank you for calling in.
You too. Bye.
All right, bye-bye. That is so good. I'm so happy to know it helped her. So, guys, if anybody else wants to call in, feel free to link it. I think I can do it without putting your name up on the screen. I got to figure that out. But if anybody wants to call in, Sandra, I don't know if you're still here, but I'll wait a few minutes. You can put your question in the chat. Let me see. Somebody said, Cherry says, thank you. I really enjoyed this live and your replays. I'll be back tomorrow. And then, okay, I'm glad to know, Cherry. I look forward to seeing you. So that's what I was saying. Yeah. So I don't know what time yet. I'll be going live tomorrow. It's going to be sporadic. It could be during the day because I have so much to do tomorrow. But I have stuff to do tomorrow night at 8 p.m. So I possibly might go live at 7 p.m. right before my event at 8 p.m. maybe, or it could be during the day. I'm not sure, but I'll definitely be going live tomorrow. So make sure you guys are subscribed and you have your notifications on because you'll get a link once I schedule. I'm sorry, you'll get a notification once I schedule it, and you'll get a notification once I go live. MN says, I like to get notifications, but I haven't a long time. Do you go live every Thursday? No, MN, I'm just going live every day this month. So this month, yeah, every Thursday I will be live, but I'll be live every day this month, MN, because MA Appreciation Week is October 21st. So guys, please make a note of that. MA Appreciation Week. We're going to show off, y'all. If y'all want any of my MA t-shirts, get your MA t-shirt. And I just really want to celebrate us. And during this month, when I go live, every day I'm going to be talking about something different. So we're doing terminology this week. Tomorrow, I'm going to be answering some questions that I got submitted in. I'm going to be going through those, and I'll probably touch on, oh, you know what? I need to go through abbreviations. So that's what I'm going to do tomorrow too. I'm going to do, I'm going to go over some abbreviations that you need to know for the certification, and then I'm going to answer some questions that were submitted. So I'm going to do that tomorrow. And then next week, I'm going to do some more certification practice, but I'm going to talk about some other things as well. We're going to talk about some, prepping for interviews. We're going to talk about ways to find a job. And some of this I've talked about on my channel before, but of course things change, things get updated. So we want to, everything medical assistant we're going to discuss. And then MA week, I'm going to have some guests on. So that entire week I have somebody coming on with me and we're going to have some conversations and stuff. So, oh, Cherry said no matter what time I'm going to stop. I know that's right, Cherry. And you on it. You know your stuff too, Cherry. You're welcome, Kayla. I'm glad you made it on. Hey, Jasmine. Oh, Kayla said I'm gonna be on too, no matter what time. Okay, I know that's right, y'all. Y'all trying to learn. I love it. I love it. Oh, Kayla said I have my CMA on Monday. Oh, Kayla. Oh my goodness. Good luck to you, Kayla. Kayla has her CMA. So you're taking it through AAMA, Kayla? That is amazing. Her test is on Monday. Oh my goodness, Kayla. I'm gonna try to do some certification practice this weekend. I'm definitely gonna go live this. Thank you, Jasmine. Jasmine said, don't forget to like the video. Jasmine, I'm getting ready to make you a chat moderator. Yeah, please like the video, y'all. You can, please, if it was helpful, like the video. Thank you, Jasmine. I'm gonna make you a chat moderator if you want to be a chat moderator. But what was I going to say? Maybe so because I'm going live this weekend too. So I'm gonna try, Kayla. I'm gonna try to come up with some slides, with some more slides for certification practice, and I'll try to do that on either Saturday or Sunday. So that way you can get a little bit more practice and a little bit more study and before you take your test on Monday. You're welcome. Cherry said, do you have a video on interview tips? I have a video, not specifically on interview tips though, Cherry. Like I was doing a Q&A video and I did give like some tips on it. So I don't even remember, but it's one of my Q&A videos, but I am going to go over interview tips in one of my lives next week. Yeah. And then Jasmine, I just have to invite you to be a moderator. Let me see if I can do that from right here. I got to figure out how to do that from right here. What's your channel handle, Jasmine? Is it at Jasmine? Type it in the chat, and I think I can invite you that way. I can't remember. I did it once before. I had a moderator before, and I can't remember how I did it. But I know I need your handle, like at whatever your at is beside your name. Okay, you're welcome, Kayla. You're welcome. Any other questions, guys? Oh, Melissa said, I'm just about to start watching part 6. I finally got to join your live. Hey, Melissa. You just caught us at the end. We just went through it, but don't worry. It's going to be, the replay is going to be up just in a little while. Literally, I think once I end it, you can watch the replay. Let's see. Okay, I got you. Let me copy this. And then, matter of fact, let me take I can't copy it for some reason. I'm just going to take a picture of it. And then I think I can invite you. Okay. Any other questions, ladies and gentlemen? If not, I'm going to get ready to end this. I just want to stay on for a few more moments. I don't want to miss anything. I'm not in a rush tonight. Last night I was in a rush because I had a Zoom at 8 that I had to get on, but I'm not in a rush tonight. So if anybody has any questions or anything, let me know. And thank you guys for hanging in there with me. We was on here for what, 45 minutes? Well, 50 minutes now. I don't see any other questions. Are you coming out with your own study guide? Yes, I do have my own study guide, Melissa. It's at marefreshercourse.com. It's on the screen. So it's marefreshercourse.com. That's my own study guide. So I go through, I have video lessons on there. Let me play this again. So just to show you guys that I have video lessons. So this is it right here on the screen. And I have modules. So it's 12 modules all together. We go through anatomy and physiology, medical law and ethics. And after every lesson, it's a quiz. So you see that screen there, that's the quiz. And then you get a score and everything. And then after you go through all of the modules, every module, you take the quiz, there's knowledge check questions. And then at the very end, I have 3 practice tests. What each of them had 50 questions. So all together in a study guide is about 400 and something practice questions that are similar to what you'll see. So it's not going to be the exact question though, but it's very similar to what you'll see on a test. Um, and I've been getting some pretty good feedback from it. Yanni was just on here. She said it was very helpful for her. Everybody that has had it been pretty much telling me it's been very helpful. So, and I'm actually still adding to it. I'm actually going through the quizzes that I have on there. I'm going through and doing a screen record and going through the quizzes with you. So I'm actually adding more to it. Roll up, roll her up and pass this tea. Oh, I like that name. Says, I'm so happy I finally got it live. I take my test on Saturday. Oh my goodness. You take which test are you taking? Click the call in link, roll her up. Click the call in link and come. Let me hear your voice. Let me come talk to me. Quism said, when you do practice tests. I'm asking, I'm thinking you were saying when am I doing practice tests? So there is practice tests within the study guide. So there's the quizzes right after the module, and then there's the actual practice test. Is the course better for CCMA or works for all types? So it works for all types, Kayla. So I specifically, even all the videos that I do, even though the playlist says CCMA, it works for all of them. I try to stick to foundational information because honestly, guys, and I think I mentioned this either yesterday or the day before, honestly, the same information is on each test. Honestly, the foundational information is the same. Now, one test like the CMA, Kayla, you're taking a CMA, that test they say tends to be a little harder because it goes over a little bit more. But for the most part, it's all the same information. Everything that we went through tonight, terminology is the same on all the tests. Also, my study videos that you guys have been watching, my playlist, the questions and stuff you guys have been going through, all of that information is the same on each test. So yeah, everything I do, it helps you with all of them. What tools do you have on? I think you mean remembering what medication should be done. I am. Honestly, I don't really have I don't have it like a sheet or cheat sheet, anything like that. But you will know which medications are given in which route. First of all, ID. I'm gonna just say that's the easiest one. You always want to give your PPD ID. So like flu shot is intramuscular, sub Q, insulin is sub Q. What else? Hepatitis B vaccine is intramuscular. So as you once you get out there and you do more and more, you'll know. And when you get to your office, they're not going to, they're not going to just put you out there and you're gonna have to know everything right away. Like they know you're new. It's going to be, they'll have something to let you know, okay, hepatitis B, flu, what else? HIV. Those are all intramuscular. And then you have like varicella vaccine, MMR, those are sub Q. So you'll know, but I don't have like a specific, like I don't have like a trick way of remembering them. Just studying, just making notes. Like if you want to make a note, or you know what, you just gave me an idea. I think I'm going to make something like a free downloadable or something, just a list that people can look at and study, and it'll just have like different vaccines, and it'll say which route you give it in. And then there are some that are available either way. Like you have some that will be available in a sub-Q form and intramuscular form. Melissa says, I was just about to buy the NHA study guide. What tips do you have? Oh, that's the same one. I'm on part 13 of the videos. Okay. Yep. Sub-Q is MMR varicella. Yep. Those two are sub-Q. Also, insulin as well. And then everything else is pretty much intramuscular. And then, of course, PPD and allergy tests are intradermal. Hello from Central Illinois. Hey, Erica. I've been a clinical administrator for 20 years and I'm a CCMA student. I decided to go back to school for some clinical training. I'm learning so much. I'm so glad, Erica. That's so good to hear. So clinic administrator, wow. And now you see that's wow. Okay. That is amazing. How are you liking it so far? How are you liking the class so far? Hey, Miss Late. Hey, Miss K. I'm late coming on, but I can rewatch the video. I want to get you about about the refresh. Okay, gotcha. Okay, Heather. Is this the same Heather that was on last night? You weren't with me, right, Heather, last night, right? I went live on TikTok last night, yeah. After I went live here on Facebook, when I got off with you guys, I went live on TikTok and I had a Heather there too, but I I was like, Heather, are you the one that was just on YouTube with me? I don't know if that was, I don't, it wasn't obviously because the last name was different. Do you have tips on remembering the 50 most used medications? So this is going to go to, go back to flashcards and studying them because a lot of this, guys, I'm gonna be honest with you, a lot of this is going to be a matter of you really absorbing it and keeping it in front of you and constantly studying and looking at it, because the more you look at something, the more familiar it becomes with you. And one thing I never do is suggest memorizing anything. I want you to absorb it versus, not saying that you're saying memorize it, but I just want to mention that because I do get a lot of people, even some of my students tell me that they're trying to memorize something just to take the test. And when you're just trying to memorize something, you're not, it doesn't stick. There are some things that you guys are learning right now that 20 years from now you're going to still remember, and that's because you're absorbing it. The things you're going to forget are things that you are just trying to remember for the test. So I want you guys to, especially for those of you that's still in school, that's one tip I can give you guys that's still in school. Focus on knowing it, like absorbing it, letting it become a part of you. Okay. Even as an instructor, teaching all these years, there are still a lot of things I forget. Because sometimes, even when I'm in class teaching my students, I can forget. I don't know everything. I forget stuff, and that's because if I don't see it all the time, I forget it. But then there's some things that's just never going to go away because I've absorbed it. So you want to just work on absorbing things. But as far as the medications, just create some flashcards. We used to do this at my old school. The students, and it was 50 of them, 50 medications. And they had to, on one side, you put the name of the medication, and on the other side, you put the classification, like was it an antipyretic, like a fever reducer? Was it a analgesic, like a pain reliever? So you want to put the classification for it, and then what it's used for. So like headache or fever or hypertension or whatever, and also the pronunciation too. Oh, Heather, she said this is the Heather on YouTube. Yes, that was you. That was on last night. Okay. Oh, that's good to know, Erica. Thank you. All right, guys, let's see. Let me just make sure I didn't miss anything. Heather, was that you last night that said you was gonna call in? One of y'all said y'all was gonna call in. I should have took Sandra's question early because Sandra did log in backstage with the question. I should have just, so next time somebody logs in, I'm just gonna pause and just take it while they are back there. Oh, guys, too, don't forget, MA Appreciation Week is October 21st. That week, I'm going to have some special guests on. So I have this one young lady coming on. She has her own phlebotomy business. She's a medical assistant, but she has her own phlebotomy business. I'm going to have another lady on that I had on before who has her own school. And then I'm going to have Brian on. Brian is he helps you guys with like CEU. So he's a program director for a medical assistant school, but he's going to give you guys some information on keeping your certifications active with your CEUs. And then also I'm going to have the MA expert on. She helps with different things like just career wise and all of that. So she's the MA expert. She's going to be on that week as well. That's the week of October 21st. All right. Let me take a drink of water. So Jasmine, I'm going to invite you, and then hopefully it can work. If not, I got to figure it out. I was able to do it before, but I can't remember how. Okay, guys. I don't see any other questions. We are at an hour now, and so I see there's still some of you guys watching. If this was helpful to you, do me a favor and just like the video, and that's just a way to help me out a little bit. And I'm going to go ahead and let you guys go. It's 7:47. I'm going to go ahead and eat me something. And then what I'm going to do tonight, I'm going to work on what I want to do when I go live this weekend. So I'm gonna try to work on some slides for certification practice. So I do want to try to do that this weekend. Because I know Kayla's taking hers on Monday, Yanni's taking hers next Wednesday. And so I want to try to get some of those in. Okay, you're welcome. All right, y'all. Y'all have a good night. See y'all tomorrow. I don't know what time yet, but I'll see y'all tomorrow.